Let me just say that wearing masks should not be political. I just listened to the governor's press conference, as well as to the head of the Health and Human Services at the state level. They all were recommending that people wear masks or face coverings. I'm wearing a mask. The mayor pro tem, well, he's wearing a mask. I just knew you were wearing your bandana. Okay, he has his bandana. And so it shouldn't be political. I mean, I'm affiliated with one party, the mayor pro tem is affiliated with another, and we both have face coverings on. The reality is that this virus has no respect of persons. It doesn't care whether you're a Republican or a Democrat. Many of the people that have been infected by this virus were Democrats and Republicans. Many of the people who have died have been Democrats or Republican. And if anyone questioned that, just continue to get in large groups and don't wear face masks or face coverings and see what happens. This virus is not going to skip over you because you are a Democrat, and it's not going to go around you because you are a Republican and just go at the other. It should not be political. Certainly in the city of Houston, I would like to think that the way we have handled this particular situation since the first week in March has not been based on whether or not whether or not one was affiliated with one party or another. So I will tell you that it works. The face coverings, the face masks, they do work. And because what people have done collectively, lives have been saved. I do regret that at times it seems as though it could take on a political political flavor, so to speak. But I regret that because in the end, the virus is going to remind us. I didn't tell you which party I was affiliated with. If you were living and breathing, I got you. And I think that's what's going to happen at the end of the day. Well, let me just say from the vantage point of the city of Houston, we're going to do everything on our part to make it to try to make what the governor has said, make it work to keep everybody safe. So we're going to do everything on our part to achieve that overall objective. The people in the city of Houston, and I speak myself, we want things to open up. We want the economy to open up. We want people back on their jobs. We want businesses open. So let there be no question about that. I probably would choose a different pace than what he has chosen because now, bars and bowling clubs and youth sports camps, summer camps, things of that will be opening up. My only hope and prayer is that several weeks from now, we are not going to see a spike occur. And at the same time, just because anyone, whether it's me or was the governor, was anyone else, say things are open, I think people are going to exercise their common sense, and they're going to do those things to help protect themselves and their family members. And that's what I have seen over the last 30 days. What I will say is that there's been this statement made that the percentage of positive cases has come down, less than 5%. So for the months of March and April, we were just testing people who were symptomatic, had signs and symptoms, which means that denominator was very small. And so when people tested positively, you had a very high ratio. And then you notice in the city of Houston, we started testing everyone, whether you were symptomatic or asymptomatic, whether you had symptoms or you didn't have symptoms. And in the last, let's say 30 days, we have increased the number of tests. In March and April, we weren't testing nearly as much. Now and in the last 30 days, we have exponentially increased the number of tests, and we are testing everybody, symptoms or no symptoms. And so rightfully so, your numerator is going to be at X, and your denominator is going to be X plus Y. And so your percentage of people testing positive will be lower. Now so you can't, we're measuring apples and oranges right now, So you can only determine whether or not that percentage has dropped if you're taking the same number of tests that were done back then, and you were only testing symptomatic cases. Have we flattened the progression? Yes. Okay. Has what we have done collectively worked? The answer is yes. Have lives been saved? No question about that. Okay. Has the virus disappeared? No. Is there a vaccine right now? No. And if we come together and treat this virus as if it's yesterday's news, do we run the risk of fueling this virus and facing another spike or several spikes down the road? I believe the answer is yes. But let me defer to Dr. Persse.
Thank you, Mayor, and thank you, Mayor. You know, you're exactly right. The good news is that we have a lot of people working very hard and collecting data. The bad news is that then creates a variety of different sources, and they don't always say exactly the same thing. So when I look at those different sources, what I see is that the trend amongst, while the numbers are different, the trend is similar. And the trend is basically that we've got a very flat, maybe even a slightly decreasing, but basically a pretty flat indication of the activity of the virus. And the mayor's right, as more testing gets done, more sites, more tests being done, the raw number of positive tests will go up, but the percentage is what we need to watch. And so right now, Houstonians, I think, need to be proud that they have done a very good job. As we move forward, because the number isn't zero, the virus is still in the community and it is still being spread, because if it wasn't spreading, then the number would have dropped to zero and nobody would be testing positive. So while the different sources of information can be confusing, if you look at what they really sort of say as opposed to the actual number, they're saying pretty much the same thing, that the virus is out there, it continues to spread, Houstonians are doing a good job, but we need to remain vigilant as we change our daily activities. We need to not lose the benefit of the lesson we learned over the last several months about how we can be effective at slowing down this virus.